Assalamualaikum and good day everyone. Today our group will briefly explain about insulin Aspart versus insulin Detemir. These are our presenters for today. These are our focus for today's video: drug profile and patient counseling points of insulin Aspart and insulin Detemir. Let's begin with the basic. What is insulin? Insulin is a hormone produced by the pancreas that helps the body use or store glucose for energy. Without enough insulin, blood sugar levels rise, leading to hypoglycemia and long-term complications. In this diagram, we can see that insulin works as a key and glucose as a lock. For your information, insulin Aspart and insulin Detemir is the generic name, and Pharmacotherapy and Detemir is the trade name or brand name. This is just the mechanical of insulin pen. You can have a look for a moment. Insulin Aspart and insulin Detemir, two of these drugs produced by recombinant DNA technology in Saccharomyces cerevisiae. One prefilled pen contains 3 ml equivalent to 300 units. Both of these excipients and inactive ingredients are identical, but the difference is Pharmacotherapy have zinc chloride and Detemir have zinc acetate. As you can see in the picture, insulin Aspart is the rapid-acting insulins and insulin Detemir is the long-acting insulins. Both of these characterized under injectable glucose-lowering drugs, IGLDs, which is the receptor agonist. Both of these drugs have a different onset, peak, and duration. You can have a look at this insulin chart to compare. Let's have a look at insulin secretion. There are two types, bolus and basal insulins. Bolus is for rapid-acting and short-acting insulins, which work quickly and have a shorter duration compared to other insulins, used to control blood glucose levels at mealtime, while basal insulin is for intermediate and long-acting insulins, work more slowly and last longer than other insulins. They provide background action to help keep blood glucose levels from going too high throughout the day and at night. At this picture, you can have a look. The long-acting insulin work at the background, and for the bolus insulin, the rapid-acting or short-acting insulin need to be administered at each meal. We already know much about insulin Aspart and insulin Detemir. Insulin Aspart control blood sugar during meals, usually given together with long-acting insulin to ensure proper glucose control, while insulin Detemir maintains baseline blood sugar control. It provides basal level of insulin to facilitate glycemia control throughout the day. For the route of administration of insulin Aspart, it can be taken by subcutaneous injection and intravenous injection, while insulin Detemir, it can only by subcutaneous injection. For the mechanism of action of insulin Aspart, in the picture you can see that it depicts subcutaneous injection of insulin Aspart. The insulin's molecules rapid analog monomers are short entering the bloodstream. Peak time is 1 to 2 hours after injection, indicating quick absorption. Rapid analogs show that it have faster onset, earlier peak, and shorter duration. While for insulin Detemir, subcutaneous injection release insulin Detemir binds to albumin, forming a reservoir in the bloodstream. This slows absorption and prolongs the duration of action. The curve is flat and prolonged, showing that it have steady glucose lowering effect, lasts up to 24 hours and no distinct peak. I would like to show you a quick calculation of insulin Aspart and insulin Detemir. Assume that you are going to eat 60 grams of carbohydrate for lunch. Your IC ratio is 1:10. To get the carbohydrate insulin dose, plug the numbers into the formula. Carbohydrate insulin dose equal to total grams of carbohydrate in the meal, 60 grams, over grams of carbohydrate disposed by 1 unit of insulin, 10. So you get 6 units. You will need 6 units of rapid-acting insulin to cover the carbohydrate. For insulin Detemir, basal or background insulin dose is equal to 40 to 50% of total daily insulin dose. Example, assume your weight is 160 pounds, your total daily insulin dose will be 160 over 4, so you get 40 units. In this example, basal or background insulin dose is equal to 50% of TDI, 40 units, so you get 20 units of either long-acting insulin such as Glargine or Detemir, or rapid-acting insulin if you are using an insulin pump, continuous subcutaneous insulin efficient device.
Now, we go into the therapeutic indication and clinical use of insulin Aspart and Detemir. First, what are the meaning of therapeutic indication and clinical use? Therapeutic indication are a description of the disease to be treated with a medicine and the population for which the medicine is intended. They include specific about the disease and restriction on the patient population, such as age and whether the medicine is intended for symptom relief, cure, prevention, or diagnostic use only. Moving on, clinical uses refer to the application of medical knowledge, procedures, or treatments directly to the patient in healthcare settings. It encompasses the practical aspects of healthcare, including diagnosis, treatment, and management of illness and injuries. Therapeutic indication and clinical use of insulin Aspart and Detemir. The drug pair focus on two major types of diabetes, which is type 1 diabetes and type 2 diabetes mellitus. There is also a special case of gestational diabetes mellitus that happen in pregnant mothers. Here we include the differences among the three types of diabetes mellitus. For references, here are the clinical characteristics for type 1 and type 2 diabetes mellitus. We can also look into some example of case studies for insulin Aspart and Detemir, where they talk about a randomized trial using insulin Aspart and Detemir compared with usual care. Now, we go into the summary of pharmacokinetic aspects of the drug pair. Pharmacokinetics of insulin Aspart. It is rapidly absorbed after subcutaneous injection and widely distributed throughout the body and acts on insulin receptors. It is degraded by proteolytic enzymes and primarily excreted in the urine. Next is pharmacokinetics of insulin Detemir. It is slowly absorbed by the subcutaneous tissue and has a constant concentration over 24 hours. Insulin level in the blood were highest at around 12 hours after injection and went back down to normal about 24 hours. Insulin Detemir has a high volume of distribution and has no interaction between plasma protein or fatty acids. It is metabolized by the liver and kidneys, and all metabolite forms are inactive. As for its creation, it has a terminal half-life of 5 to 7 hours depending on the dose. 30 to 80% of circulating insulin is removed by the kidneys.
I'll now go through some important patient counseling points for insulin Aspart and insulin Detemir, especially their dosage, administration, and what to expect during therapy. For patient counseling, always remind patient to use correct injection technique and to rotate injection sites regularly to prevent lipodystrophy. Blood glucose should be monitored regularly, especially when changing doses. And a key reminder, insulin Detemir should not be mixed or diluted with any other insulins. Duration of therapy. When it comes to duration of therapy, both insulin types are meant for long-term use in managing diabetes. Patients should continue their treatment as prescribed and never stop or adjust the dose on their own. Regular follow-ups and monitoring are key to safe and effective treatment. Moving on to side effects. This differs slightly between the two. For insulin Aspart, the most common side effects is hypoglycemia or low blood sugar. Other reported effects include injection site reactions, skin rashes, and in rare cases, anaphylactic reactions. Some patients may also experience peripheral neuropathy, diabetic retinopathy, or lipodystrophy. For insulin Detemir, hypoglycemia is also very common. It may cause allergic reaction such as rash or itching, and in rare cases, serious allergic responses. Other side effects include injection site reactions, refraction disorder, lipodystrophy, and occasionally edema. To manage these effects, always advise patient to carry a source of fast-acting sugar like glucose tablets or juice for quick correction of low blood sugar. If hypoglycemia happens frequently or if there are any ongoing skin or side reaction, the patient should report it to a healthcare provider. The dose might need to be adjusted.
Contraindications and precautions. There are two common contraindications, which is hypersensitivity and patients having an episode of hypoglycemia. So there are three precautions. First, patients should never share pens or cartridge. Second, beware of symptoms of hypoglycemia. And third, rotate injection sites within the chosen area to prevent lipohypertrophy. Next are drug-drug interactions and food interactions. First, for insulin Aspart, there are drugs that can actually increase risk of low blood sugar, such as diabetes medications, SE inhibitors, fluoxetine, fibrates, MOA inhibitors, salicylates, and octreotide. There are also drugs that can reduce insulin effectiveness, such as steroids, diuretics, estrogens, niacins, HIV medications, thyroid hormone, asthma medications, and atypical antipsychotics. Pentamidine also may increase or decrease the blood glucose reducing effect of insulin Aspart, and beta blockers and clonidine may mask the signs and symptoms of hypoglycemia. While for insulin Detemir, there are drugs that can also increase the risk of low blood sugar, such as diabetes medications, GLP-1 receptor agonists, SE inhibitors, beta blockers, MAOIs, fibrates, salicylates, and sulfonamides. There are also drugs that can actually reduce insulin effectiveness, such as glucagon, steroids, thyroid hormones, atypical antipsychotics, diuretics, stimulants, or contraceptives, and danazol. There are three drugs that can mask hypoglycemia symptoms, which is clonidine, guanidine, and risperidone. Cautions: PPAR-Y drugs may cause fluid retention and worsen heart failure. While for food-drug interactions, both insulin can interact with alcohol, since alcohol can affect blood sugar levels, which may cause either low or high glucose levels. So the risk depends on amount and frequency of alcohol intake. So you have to avoid alcohol if you have uncontrolled diabetes, high triglycerides, nerve damage, and pancreatitis. But if you choose to drink, you have to keep it moderate. Do not drink on empty stomach. Avoid drinking after exercise. Always follow your meal plan. Let your doctor know about all medications, vitamins, or herbs, and never stop medications without medical advice. Next, for drug storage and drug handling. First, where you store the drug, you have to keep it between 2 until 8 degrees Celsius when it's unopened, like pen, cartridge, or vial. Next, you have to keep away from cooling element. And last, if the drug is open, like pen or cartridge, for insulin Detemir, you have to store between 30 degrees Celsius for up to 42 days. For insulin Aspart, you have to store between 30 degrees Celsius within 4 weeks. To handle the drug, you have to not refrigerate or freeze, protect it from light. Very careful when handling used needles. Dispose of your plasma carefully without the needle attached. Always keep your pen and needles out of sight and reach of others, especially children.